Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, reports of surprise billing and out of network shenanigans involving the Christ Health Center. And I was a patient and customer of this Birmingham, Alabama based medical practice in 2019. Around $200 in expenses and absolutely zero results, not to mention 5 years worth of hassles trying to get resolution in this thing. I'll go into my own issues later in the video, but today's review comes from a patient experience at the Chalkville, Old Springville Road location, and this appears to be from 2023, and it reads, "If I could give a zero, I would. Doctors are very nonchalant. They don't listen to you. It's a different provider. Every time I go to them, they rush you out without listening. They don't run tests or take x-rays unless you request it. They have no compassion. You're just another chart in rotation, not an actual human. And they put any provider that's not in your network to treat you without your knowledge or consent, then send you a bill for a visit that was supposed to be covered. You do not find out till you go to pick up your medicine that you have to pay. The pharmacy then informs you that the provider who wrote the script is not in your network. They discourage every concern that you have about your health. Really horrible level of care." So several correlative items here to my own experience. They're describing some issues that are supposedly addressed by the 2020 No Surprises Act in the United States, which is actually federal law. And this involves what's called balance billing or surprise billing. And these are medical bills from a healthcare provider billing a patient for the difference between the total cost of services being charged and the amount the insurance pays. Wikipedia describes this as a pervasive practice in the United States with providers who are out of network and therefore not subject to the rates or terms of providers who are in network. Critics say that balance billing lets providers raise charges through stealth rather than transparent pricing, creates unnecessary administrative costs of patient confusion, and allows providers to simply pass along costs to patients rather than helping them to secure good value. The No Surprises Act supposedly protects patients and customers from balance billing, exploitation, and abuse. The Mayo Clinic defines surprise billing as an unexpected balance bill that can happen when you cannot control who is involved in your care, like when you have an emergency or when you schedule a visit at an in-network facility but are unexpectedly treated by an out-of-network provider. Surprise medical bills could cost thousands of dollars depending on the procedure or service. When I had problems with Christ Health Center, I was referred to an individual who is supposed to help me with my issues. And I was not told at the time that this individual was actually going to be their attorney. This lawyer then attempted to invoke federal protections to shield them from my complaints. So it looks like Christ Health runs on the margin of what is ethically acceptable and legal. And this is absolutely disgusting because the patients who go to community health clinics like Christ Health Center, they have absolutely nothing. They have no money, they have very little money, they have very little resources, and they're being taken advantage of. And this is an unacceptable practice. My rundown of issues with Christ Health Center, Birmingham, Alabama. I believe I received no measurable level of service in my visit. I was charged the same amount of money, $110, to see the doctor and MD as the nurse, a nurse practitioner. Other medical practices around Birmingham, I paid roughly half of that price. Christ Health is partners with Ascension, St. Vincent's Hospital, and it looks like either Christ Health decided to ignore my injury or were ordered to ignore my injury. And I believe this is to protect the reputations and $1 million salaries of the, quote, professionals, unquote, involved. I also believe I may have been patient dumped, and that's a violation of EMTALA, EMTALA, in the course of my seeking treatment. I was a self-pay patient, I had no insurance, and I could provide no stated source of income. Dr. Terry Daniel Smith, MD, outright refused to grant me a referral for an MRI. Just a few days later, I got that MRI. I had to pay cash out of pocket, and broken bone surrounded by infection shows up in that scan. Broken bone also shows up in the CT scan. He claims in his notes in my medical chart to have reviewed in detail. I was billed $50 for a hemoglobin blood test and electrocardiogram I never received. And yeah, I think taking money from people who don't have anything, such as myself, is obscene. Nurse Musgraves wrote in her report that she suspected psych etiology to explain my symptomology, and this is absolutely wrong. Broken skull bone is visible in the MRI, CT, and X-ray that I've had done. Nurse practitioner Anna Musgraves agreed to give a referral when I secured my MRI. So I had to go out and find another medical practice with the equipment who could do the scan. I was given 3 avenues of financial assistance to pursue, and all 3 of these led to dead ends. I did not qualify. This is for Ascension Access to Care, Cooper Green Hospital, and UAB Hospital in Birmingham, Alabama. After I paid $500 cash out of pocket for an MRI at American Health Imaging in downtown Birmingham on the south side, the diagnostic center staff told me that they needed a medical referral. I informed them to call Christ Health Center in Woodlawn. They were put on hold 15 minutes, and then someone, we don't know who, at Christ Health Center hung up the telephone. They backed out on giving that referral. I believe somebody didn't want me to get this MRI scan because it would show the truth of an injury that I was told I did not have. A medical doctor I had no interaction with also strangely edited and signed off on my records and chart days following that visit. This was shortly after I lodged my first official complaint for lack of service from Christ Health. This doctor was Beverly Vanderpool. I put all my records from this visit in several hours worth of video on YouTube channel My Medical Nightmare. You can go there and see my side of this story. Deborah Pickens also tells me that a letter with a statement was going to be put in the mail to me after that August 2023 meeting. And what I can say is I have not yet received this promised letter. 1 year later, they know my address too because they sent me those bills for those medical services that weren't performed on me. So people out there looking at healthcare options in the Birmingham, Alabama area, please take my experience to heart, and I would advise that you look elsewhere when seeking medical treatment from a doctor or a nurse. In a recorded telephone conversation with Christ Health attorney Deborah Pickens, August 2023, she made an obligation that my issues would go before their board and the results of their discussion on what happened to me would be outlined in a postal mail letter that would arrive at my mailbox. 2 years later, as of August 2025, I never received this letter. I'm not exactly an expert at all the buzzwords applied to these scams. Upcoding and phantom billing. These are 2 common healthcare scams that I was apparently a party to as a patient and customer, and this involved Birmingham, Alabama area community health clinic, the Christ Health Center. They were affiliated with Ascension St. Vincent's Hospital, recently rebranded UAB St. Vincent's. The U.S. Federal Bureau of Investigation FBI website describes these scams on its healthcare fraud page. Phantom billing for a service visit or supplies that the patient never received. And upcoding, billing for a more expensive service than the patient actually received. The U.S. Centers for Medicare and Medicaid Services rate both of these scams on the upper level of their scale. Very serious. Also took my issues to the state of Alabama Board of Medical Examiners and Medical Licensure Commission in the form of complaints. I filed a complaint against both Dr. Terry Daniel Smith, MD, and nurse practitioner Anna Musgraves. The state of Alabama would not do anything to help me with these, despite the fact that the documentation that I supplied with these was rock solid. You can see it here in the video. It's their own paperwork, the bills, and the doctors and nurses' own notes. These are part of my medical records.